Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Heather Hanson. She's a communications consultant and attorney. Today's Kevin MD article is Why Every Doctor Needs a Translator. Heather, welcome back to the show.
It's so good to be back.
All right, so you've been on in the past. We've been talking offline. It was more than 3 to 4 years ago. So just briefly introduce yourself and then talk about the Kevin MD article we're going to discuss today.
Happy to. I defended medical providers in medical malpractice cases for 25 years, and I loved it, and it was enormously stressful for my clients and for me. Now I do the communications and strategy consulting. I work with doctors on communication and also to prepare them when they are facing a trial. And one of the things that I did in that role and what I write about in that article is overcome what I call the curse of knowledge.
Hmm.
Doctors and medical providers in general, they know things so well that they forget what it's like not to know them. So fetal monitoring strips, trochanteric wires, osteomyelitis, all of these things that are normal words to various specialties are not normal words to our jurors. And so the ability to translate those words in a way that the jury understands them was my job. And I know from all of those years of doing that work that if doctors and providers can learn to do that on their own during the care at issue, a lot of times that actually prevents lawsuits. And in a more proactive way, it also improves HCAP scores, it improves patient compliance, it improves the relationship between doctor and provider and patient. And so it's really imperative for all of us to learn how to sort of communicate in a way that's clear on both sides.
So take us behind the scenes of one of those coaching or conversations with doctors in terms of clearing up their jargon and making sure that they communicate in plain language. What are some of those sessions like?
Well, so much of it is just starting to recognize where that jargon lies and to see things from a different perspective. I really, what the easiest way to do it when we're in the courtroom
Hmm.
is the courtroom is such a new environment for a provider that they feel out of place, they don't understand, they're confused by things. And it's a great way to say, this is how your patient feels. This is how your patient feels.
Yeah.
For me, going to trial, I did it all the time, Kevin. But for the doctor, ideally, it's the first and only time that they're stepping into that environment. It's the same thing for a patient. Doctors, surgeons do surgery every day.
Yeah.
But for a patient, hopefully, it's the only time that they have to do that. And so putting yourself in those shoes in any way that you can is imperative. Now, there is a difference. One of the things that I really talk to doctors a lot about is you don't have to feel empathy in an effective way. There's two types of empathy. There's cognitive empathy and affective or emotional empathy. I actually think that doctors don't need to push themselves to feel what their patients feel, because oftentimes that's
Hmm.
pain, fear, anxiety, irritation, frustration. None of those feelings are effective. But to see things from another perspective is enormously valuable in learning how to communicate in a way that the patient's going to understand.
And I could also imagine when a physician is in a courtroom, that's obviously an unfamiliar, high pressure environment. So they're just going to reflexively fall back on their training, which is to speak in medical jargon.
Yeah, absolutely. And also, a lot of times, and this doesn't only providers, I've worked with people in other specialties that do this too. They think the jargon actually makes them look smarter.
Hmm.
But the truth is, one of the things I talk about in the article is building credibility. And I have in my work a belief triangle. So the jury, and sometimes in the courtroom, the jury deciding the case. But for you tomorrow, your jury is your patient
Yeah.
who you want to persuade them to take a certain medication. And so the belief triangle says they have to believe you that when you set an expectation, you'll meet it. When you make a promise, you'll keep it. They have to believe in you, your curriculum vitae, your experience, your training. But most importantly, the foundation of that belief triangle is they have to believe that you can help them.
Hmm.
And so it's really the ability to see the world through the patient's perspective. What is most important to them after this knee replacement? Do they want to run a marathon, or do they want to be able to pick up their grandkid and take them into the car? When you understand those things, you can speak to your patient in a way that you're truly making a connection and you're building that credibility.
In your article, you introduce a paradigm where a doctor is a translator. So tell us more about that concept.
Yeah, I think that being the ability to translate those very challenging medical terms in a way that the patient actually understands is going to serve the provider in so many ways.
Mhm.
Because a patient is more likely to be compliant when they understand the why of what they're doing. Why do I have to take this medication? Why is it helpful for me to lose some weight before I have the surgery? Why is prehab so important? And so learning to go back and translate those things, it's interesting because you talk a lot on your show about AI, and AI is going to be a huge part of medicine. And in many ways, it's going to be a huge translator. I heard Bill Gates on a podcast talking about one of the primary uses of AI that he uses is he drops in medical records and says, explain this to me like I'm in fifth grade. And so you can direct your patients there. But if you want to build a connection with them, have that conversation with them, explain it to them in a way that they're going to understand. And translating those things is going to make that relationship so much better for you as well.
So tell us some simple tips that physicians can implement in the exam room in a hospital to better communicate and maybe act more as a translator. So they're not reflexively speaking in medical jargon, and how they could improve their communications so patients can better understand and connect with them.
Okay, so the first thing that I have to say is I know as I say these things, you're all going to say this takes too long. But the truth is that a few moments of time in that office are going to be a lot less time at litigation if you're ever sued. Depositions take a long time, trial takes a long time. In addition, so for example, one of the things I recommend is slowing down. Especially with office hours, I know how busy you are. I understand it. At the same time, there's a lot of research that shows that doctors interrupt patients within seconds of them talking. But the other part that we don't talk about enough is that if they don't, the patients don't go on for 10 minutes. They tend to go on for something like 1 to 3. So slow it down. The other thing that's important to note about slowing down is slowing down brings you more authority. It changes your body language. It changes your tone of voice. And that brings you back into your credibility. And that's going to make it a better relationship as well. So slowing down is one thing. Another thing that I often talk about is this exercise that I do, and we can describe it, here it's you ask the person, and we can do this together. You snap 3 times with your dominant hand and draw a capital E on your forehead with your finger. Now, I won't have you do it, Kevin, because I don't want to call you out as to where you are today. But those listening, if you think about it, there's 2 ways you can draw that E. You could draw the E facing yourself as if you're looking at it from your own eyes, or you could draw it from the other person's perspective. And if you draw it from the other person's perspective, it's a sign that you're seeing the world through their perspective. I've reminded doctors to think about that exercise as you walk into the office. What are they seeing instead of what are you seeing? And we lose the ability to do this as we get more powerful. So residents are probably better at that exercise than an attending is. And so you want to stay as good at that as possible. And some of the ways you do that is by checking in with your residents, checking in with your PAs, your nurses, your ancillary staff, and seeing what do they see? What do they know? And then asking questions, not just questions about what are your symptoms and why are you here, but what's a good outcome look like for you? Don't just assume that it's the ability to play golf. It might be something as simple as the ability to get up and go to the bathroom in the middle of the night.
And that last question is a great way to gauge patients' values, because a lot of times in the exam room, there's normally a menu of options. There's no right or wrong way. And then what I recommend for one patient may be completely different for another, simply just based on their values. So that last question is a great gauge of that.
It is. And it's a way to build a relationship. I get really frustrated. I had a gentleman named Dr. Stephen Treziak on my podcast when I had it. And he wrote a book called Compassionomics. And it's a big, fat, amazing book about the ROI of compassion in medicine. And it's all about compassion for the patient. And that's great. But I have asked him and other doctors that I've met, what about compassion for you? And doctors always are like, wait, what? I don't even know. I'm very uncomfortable with that idea. But I do think that we patients should be extending compassion to our providers. You are overworked. There's burnout, especially since COVID. The healthcare system is also beating you up. And I think that if this can be a give and take relationship and not the old school patriarchal relationship, it's going to serve both sides of that equation.
What's your commentary about the current state of the healthcare system for things that are outside a clinician's control? Because the way I see it, a lot of the things that that you and I value, like communication, time spent with patients, building relationships, that's often not so much valued by, say, our healthcare insurers, by private equity companies, for instance, that buy a lot of these practices. So how do you kind of reconcile what you're proposing in terms of taking that extra time, slowing it down, and better communicating with patients versus the climate that we have to practice in today?
It's a challenge, right? And we know systems issues are usually the reason for lawsuits, and systems issues often contribute to burnout.
Hmm.
But if we think of the systems issues originating with a human being or human beings, then it's really a matter of education. If the private equity firms, for example, they're about the bottom line. If they understand that the bottom line gets better when there is this communication, there's been all kinds of sort of attempts to make this happen with bundled billing and all of that.
Yeah.
But there really has to be an understanding that things are not the way that they used to be.
Hmm.
The new NIH director, I recently heard him on a podcast talking about the fact that scientists have to be willing to say, I don't know. And I do think that doctors have to be willing to say the same and work things out with their patients as partners. And that does take more time than just simply saying, here's a procedure, here's a prescription, go do it and see you later. And they'll learn easy or they'll learn hard, but the people at the top are going to learn that what they're doing now does not work. It doesn't work for the provider or the patient.
Tell us a success story, maybe a before and after scenario where you made some changes in a specific physician and changed their communication skills to implement some of what we're talking about today and talk about the outcomes. Tell us a success story.
Well, I'll tell you a story that I just think it's my favorite story to tell. I
Sure.
had a doctor who I took through a deposition and he was angry, and understandably so. Doctors don't go to work to hurt people for the most part. And so therefore, almost all the time. And
Hmm.
so they are sad and frustrated and yes, angry, usually not at the patient, but at the patient's attorney. And this particular doctor was very angry. And no matter what I said to him, he was not able to manage that anger at deposition. And so he really flew off the handle. As a result, one of the things you doctors should know is in many jurisdictions, plaintiffs' attorneys share that information. They share if you're not the best witness, if you're a witness that they can get to pop
Mm.
off. And so that doctor then got sued again. And it was in pretty quick succession after that case, because one of the things that plaintiffs' attorneys often look for is damages and a bad witness. And then
Hmm.
they'll sort of use that to create liability. And so he got sued again. We had another deposition and I begged him. I said, just give my way a chance. Let's talk about your energy. Let's talk about your tone. Let's talk about thinking about the enemy, not as one of the things I always talk about is the enemy is not the opposing attorney. The enemy is confusion. And
Hmm.
if you can slay confusion, you will win. And so I said, please just try it my way. And he did. And at the end of the deposition, the plaintiff's attorney pulled me aside, and this never happens, and says, I'm going to drop the case.
Right.
So that in and of itself was a win. But the bigger win, Kevin, was that doctor attributes his increase in patient reviews going up, his HCAP scores going up, because of the way that I taught him to communicate a little bit differently, to being aware of his tone of voice,
Hmm.
to being aware of slowing down, laughing with the patient, touching the patient appropriately. All of these things that I teach people in preparation for trial is also really helpful when you're dealing with the patient. So that doctor went from a real problematic deposition
Hmm.
to a very unusually successful deposition to that then running off into his practice itself.
We're talking to Heather Hanson. She's a communications consultant and attorney. Today's Kevin MD article is Why Every Doctor Needs a Translator. Heather, let's end as always with some take-home messages they want to leave with the Kevin MD audience.
I think the first thing is we need to focus not so much on authority anymore, but on credibility.
Hmm.
You really it's all about belief, right? It's like the placebo effect. We know that that's a big part, potentially a big part of a patient's healing and progress. And so you want to make sure that patients believe you. And that means that you make promises and you keep them. You set expectations and you meet them. The problem with that is sometimes you can't, right? You're running
Hmm.
late. And so, but then own it. Own it when you don't know the answer. Own it when you've run late. Say, I'm sorry you've had to wait. It's no skin off your nose, and it does build your credibility. And then continuing to keep up with the changes in the medicine, the peer-reviewed articles, knowing the difference between peer review and what's found on the web, on Google, and being able to explain that to patients. And then really getting to know your patients, so that bottom of that belief triangle, they believe that you can help them and their values, as you pointed out earlier, Kevin, and what they want from the outcome.
Heather, as always, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
Thanks for having me.